So my name's Daniel McDonald. I'm a surgery resident here at North Coast. So today I'll be going through a little bit of spinal disease and a little touch on the neurological exam, but I think one of my colleagues is going to be doing that more in depth in a seminar a little bit later this year. So we'll sort of touch on that. We'll touch on a little bit of just the headings, how to go through your neuro exam, and then go through your grading, your treatments involved in your spinal disease, including CTs as well. And then we'll go through a little bit more in depth in surgery and what we do here, I guess. So to start off with, neurological exam, just a brief sort of overview on how we do things. So we always start with just looking at a dog from a distance. So looking at their behaviour, and their mentation. A lot of it is sort of assessing whether that's appropriate or not. And then we move on to what we call the posture and the gait. So how they're walking, are there any deficits, are they ataxic? And then there are various ways we can classify that ataxia as well. But as I said, we'll get into more detail at another time. And then we move on to your reflexes, muscle mass, tone, and again we're just assessing things like your patellar reflex, assessing the tone of the legs. Is it upper motor, is it lower motor, which gives us an idea of neurolocalization, which is sort of the following after the neuro exam. Once we've done that, we're more looking at your cranial nerves. I'm not going to go into that today because that's a bit more complicated, but assessing your cranial nerves mostly for intracranial lesions. And then lastly, your what's called nociception or your pain perception. So again, that's just making sure that we're pinching the toes appropriately and assessing for a conscious reaction rather than a withdrawal reflex, which is important in the grading process. So next step, once we've done our neurological exam, we use that information to then localise it to a specific area. So there's various areas within the spine. So start off with the cervical spine, there's two, so either C1 to C5, there's C2 to T6, T6 to T2, T3 to L3, and then L4 through to S1. And that can change where we want to image, and that's sort of the next step as well. So once we neurolocalise, we can give a bit of an idea of prognosis depending on what we're looking at before the owners make the decision to go forward with diagnostics or not. So your differentials, if we've got a dog presenting with hind limb ataxia, the differentials can differ greatly, but probably the two biggest ones are either your intervertebral disc disease, which is very common, especially in dogs like dachshunds, or what's called an FCE, so fibrous cartilaginous embolism. So those are probably your two biggest differentials. Other things like tumours and meningitis, other infections and inflammatory conditions are possible, but they're definitely less common. So again, depending on what our differentials are, depending on what the patient's presenting with otherwise, if they're systemically unwell, if they have fever, it might change what we do. But typically the next step, we start with some blood tests to make sure that they're otherwise healthy. Sometimes we start with survey radiographs, but it's not as common. They're not very diagnostic. Sometimes you can see narrow disc spaces in the case of intervertebral disease, but a lot of the time it's not of much use. So we typically move on from there onto more advanced imaging. Again, here depends on the patient, but most of the time we use our CT, which we've got in-house, and that can pick up, especially in dachshunds, picks up well over 90% of our discs. In other breeds, I think it's still up around 80 or 85%, which is good. Some patients that we may consider an MRI if we're worried about certain tumours, or if they're a little bit older, if you're worried about it's got a type 2 disc, so more chronic disc protrusion, and they're a little bit more difficult to see on CT, so we may MRI those, but most of them will CT first, just to see what things look like. So then from here, basically once we've made our neurolocalization, we've done the imaging and we've got an answer as to what's causing the problems, then our decision is, do we go conservative or do we go to surgery? And I guess our grading is important here. Basically, we normally use a 5-point scale for grading spine. So we start with more sort of 6 points. We start with a 0, which is a normal dog. A grade 1's just painful. Grade 2 is showing mild neurological signs, and then through to grade 3, more severe neurological signs with good voluntary movement of the back legs. 4, we've got no voluntary movement, and 5, we've got absent deep pain with those signs as well. So those have a dramatic effect on whether we recommend surgery or not. They've shown in dogs between grade 2 to 4 with conservative management can still do quite well. About 80 or 83% of dogs will do well with conservative management. But typically with surgery, we can get up above 95% recovery rates, and the recovery is generally much quicker with surgery as well. Our grade 5, so that's your dogs that don't have any deep pain, a little bit different. Their conservative management success rates dropped to around 5%, and even with surgery, we dramatically dropped, considering around about 60% of dogs will do well with surgery. So we try and make that decision based on the patient, based on our neurolocalization and our grading, and also based on the clients as well. Obviously, not everyone's going to go to surgery, and not everyone can manage a dog even conservatively. So it sort of depends what their thoughts are there. So if we decide, so in a conservative management side of things, we're probably more looking at basically crate rest, pain relief, and that's pretty much it, 4 to 6 weeks, along with physiotherapy. And we typically hope to see improvement within the first 2 to 3 weeks after seeing them. If there is any deterioration, then we typically would take them to surgery. Surgery typically involves, most patients, we perform what's called a hemilaminectomy, which is we basically cut down onto the sort of the dorsolateral part of the vertebral column, and we remove the articular facets, and we burr a little window through into the spinal cord itself, well, not into the spinal cord, sorry, into the spinal canal, where we can then get underneath the spinal cord and remove any bulging disc material. Depending on the dog, sometimes we will either what's called a fenestrate the disc, so we'll actually just make holes in the intervertebral disc to try and give it a spot to come out rather than reaching up into the spinal canal. Sometimes we need to actually cut the spinal cord, the meninges outside the spinal cord a little bit so that it relieves a bit of the pressure. Typically we'd only do that in a dog that's deep pain negative and it's fairly severe, or there's severe bruising of the cord, but it's not something we tend to do routinely. So the recovery, with or without surgery, is fairly similar, but typically it's fairly strict crate resting, or at least lead controlled exercise for about 4 to 6 weeks, with pain relief as required, basically. So typically we start them on non-steroidals for about a week after surgery, and then we have them on gabapentin for normally about 3 to 4 weeks post-operatively, just to prevent any wind-up or sensitization of those nerves. Typically we expect to see, even in a dog that's grade 4 and doesn't have voluntary movement, so typically we'll keep those in hospital until they're able to at least show some voluntary movement in their back legs, because then we can remove their urinary catheter. We're confident that the areas of the spinal cord that are responsible for your voluntary movement in your back legs are the ones that are close to where they supply your bladder as well. So if you've got a dog that is moving their back legs, the urinary function should come back fairly quickly after that as well. But yeah, so normally 4 to 6 weeks of recovery at home, and then slow gradual increase on exercise. So probably a total recovery of between about 3 to 6 months until they're back to normal, I guess. There is a risk with these dogs, especially the dachshunds, but a lot of dogs will have other problems in the future as well. So I think there's about a 20% chance that a dog will have another intervertebral disc protrusion or extrusion later in life as well. So that's something that we try and make owners aware of, because it's obviously a large financial outlay as well as a lot of time for them to put in.